Well, I know you guys know me, so we're here to understand things. The more you know what your skin is doing, the better you can make the best decisions for yourself to correct what's going on. Because we all go through changes, we want to be able to make those changes maybe as little as possible so we retain the way we used to look. And so that's basically why I named it this. Understand what's going on, this way you can improve and get to where you want to be. So there's three big reasons why you no longer look like you used to look. One is genetics. A lot of this is inherited. There's three kind of bodies out there. There's ectomorphs, which are really thin, mesomorphs, which are really muscular, and endomorphs, which are heavier. And it's hard to fight that type of body type that you have. You have your skin type, from the people that are maybe a type 1, which is basically Casper the Ghost, to someone that's a number 4 or 5, which has got a darker skin. The issues one set of people have are not the same issues other people have. And you got to realize that some people have tendencies that may not be obvious. They may have some underlying pigment abilities that change what you have to do. Pore size, this is also inherited. Growths that we get from our parents, acne rosacea, this is inherited to atopic derm. This is the tendency to have really sensitive skin. And having that really sensitive skin can influence what topicals you can use or not use. If you have really sensitive skin, you can't use the more abrasive things, the more irritating things, because that's a bad deal. Sun damage. Now, this is something almost everyone here got. They did not have good sunscreens even on the market until probably the 1980s. So most people grew up without any sunscreen, and we have them now, but the damage was done back in the past. And that damage you did, even as a teenager, in your 20s, your 30s, that stays with you through your entire life. It may be a sunspot, it may be thinning skin, it may be broken blood vessels, poikiloderma, the stuff that makes you turn into a redneck because you live in the South. That's poikiloderma savati. That is sun damage. And then skin structure changes, loss of subcutaneous fat and bone. A lot of people attribute aging only to the surface of the skin. There's two big components, the surface and what's holding that surface up. If you don't address both of them, you're not going to get back to where you were years ago. Genetics is number 1. We'll kind of cover skin lesions, sebaceous hyperplasia. These are little growths that people get based on their inheritance. You can have them all. Seborrheic keratoses, also inherited. There's the actinic variety, but the actinic variety is from the sun. These are only from your parents. Milia, as we're very young, we have them. Then we have acne, and that inflammatory component goes away as we get older, and you have non-inflammatory blocked up things. These have no connection to the surface, so you can't really pop them. You have to make a little cut there to get them out. If you try to do it with a pen, well, the diameter of the pen is so small that the thicker stuff can't get out, so that it's often very unsuccessful. Telangiectasia, these are broken blood vessels on the face, which we'll treat one way. Spider veins, which are broken vessels on the leg, which we treat another way. These are vessels that once you see them at the size they are, they're no longer functioning. So getting rid of them does not, compromise your skin at all. It just makes it look less red. It makes it blush less often. You can also inherit your skin conditions. Acne vulgaris is one of them. If you have identical twins, same exact genetics, they have a 98% concordance rate in the severity of their acne. Huge things in the inheritance of certain things. Rosacea, that's also inherited. Seborrhea. This is rampant in Austin, Texas, mainly because we live in an area where we have the southeast wind, which is humid, and the west wind, which is dry. Basically, when that west wind is blowing, our skin is dry, we produce a lot of oil. Here comes that southeast wind, and we're too oily, and we try to scale it off. So we think, well, it's scaly, it's too dry. Let's stop washing, then you don't remove the oil. It's counterproductive. So you got to realize there's a lot of dynamics that aren't as straightforward as they seem. If you have seborrhea, you want to be sure you wash twice a day and shampoo once a day to get that oil off. A lot of people will stop and they don't get well. And then, of course, I mentioned atopic dermatitis. This is something that people often have, and they may have atopic derm, they may have asthma, they may have allergies, seasonal allergies. All of those go together. Now, the thing about the atopic derm, you may have had eczema as a kid. 75% of kids will clear their daily eczema, but they don't have it anymore. But then they have the dry skin in the winter. They have lots of other issues that occur Recognizing that can influence what topicals they use to make their skin better and what things you can do with them to make them look better too. So dermatology can be nothing without a photograph. Sebaceous hyperplasia. See that little yellowish thing? It's got a hint of yellow. It's got a dent in the middle. This is a sebaceous hyperplasia, one here. Less developed, but these are all what they are. They do not have that inflammatory component. If they were at 15 years old, they wouldn't have this. They'd have acne, but adults will have these sebaceous hyperplasias. These can be very easily removed. You're not destined to have them forever. They can be taken off. These are all evidences of seborrheic keratosis. They can be round, they can be multiple ones, they can be linear, you can have little ones around the eye. This is actually a condition called dermatosis papulosis nigrans, which tends to be inherited too, and they get them strictly around the eyelids and the cheek. This is what Morgan Freeman, the actor, has, and I always wonder when I see him, why doesn't he treat these things? These are so easy to take off. So here we go, sebaceous hyperplasias. We're going to use a hypercator on them. Blow away a good number of them and get them smaller. Now sometimes if you hit them and they just get a little littler, you can hit them a second time and then they're completely gone. Each time you do it, you take down a layer. So what I like to say with a lot of these cosmetic procedures, it's sort of like weeding your garden. It's not like it's one and done, you got to do it. That sun damage comes out, your genetics comes out and keeps coming out, so it's more of a maintenance thing. And that's why we have to kind of keep doing things to keep ourselves looking the way we want to look. Sclerotherapy, this is for leg veins, and what we do is we usually inject them with a little bit of hypertonic saline, so it's soft. No one's allergic to salt. It hurts a little, but what it does is irritates the inside of that blood vessel and makes it go away. So when you inject it, it irritates it from the inside and scleroses the blood vessel from the inside. So when you do this, you can actually make these blood vessels go away very, very nicely. And so here on the back of the leg, we have a lot of small ones. Now these here are your spider veins. These are reticular veins. And then the next vein up is a varicose vein. So we really just treat the spiders. We do not treat the reticular veins. But see, once you inject it, you can get the majority of these things to go away. You keep after it, you'll get that to go away too. So sclerotherapy again, the reticular vein is still there to the most extent, but you can see the one above it is pretty well gone. Now these do not go away by themselves, they only get worse. Now if you have these, the best thing is keep active. The more you exercise, the stronger your muscles are. The muscles are actually the pump that drives the blood back up your legs. Stronger muscle, stronger pump, less pressure on these vessels on the outside. So keeping weight off, exercise, all those are very critical in keeping these veins from coming back, but you can do everything perfect based on your genetics and still have these if you have a parent that has these things. So acne vulgaris, now we treat it with lots of ways. We have antibiotics, topicals, we have Accutane, but a lot of times that redness persists a lot longer than we would like. We can actually use some of these machines we have to diminish redness across the face. So here's one here after 3 photofractional laser treatments where you basically got that redness to go down. This is what Brittany did here, which looks really pretty cool. So if you're frustrated, you're not looking the way you want to look, there's little things we can do to make you get better and make you better as quickly as you want to get there, perhaps. So acne rosacea, we have a lot of redness, flushing, broken capillaries, all throughout here. So basically we are going to do a little photofacial here, which is pulsed light. So it doesn't actually burn. What happens is we filter the light so colors in the skin preferentially take up the light energy. They take up the light energy and that's what destroys them. So you have some for red, some for brown, and we have to tailor that to the color of your skin also, but that's what happens. So when we do this, we don't actually burn the person, we simply heat up the things we don't like. And you can actually make these little blood vessels go away very nicely and the brown spots go away very nicely by doing this. Now, the person still has rosacea, so they're going to be generating more blood vessels. Typically, what you will do is get a person here with a series of them, and then maybe once a year they do one to maintain the effect of it, because that will keep them good over the long haul. And for people that tend to flush excessively, this is one of the key things they can do. They can give themselves some long-term remission of that flushing. So acne rosacea again, after this, we got the color really back to normal. So now when she has, like you're having a little champagne, she doesn't turn all red and doesn't, a lot happier deal. These things show up so badly in photographs, it kind of magnifies the redness. If that is a bother for you, this is a way to have that get better. Seborrhea. Seborrhea loves to go around the edges of your hairline. This is actually the top of a person's head. Here's where his remaining hair is. He's kind of bald here. But seborrhea is going right around the edge. It loves to go around the nose, the nasolabial folds, in the ear, around the nose, behind the ear. All these are places. And keep in mind, this is from excess oil. That's why when you have this, you want to be sure you're washing your face with soap and water twice a day. But a really gentle one, for your scalp, you want to be sure you're shampooing it once a day to make that scalp also better. So this is kind of a critical thing. I do this probably 10 times a day with my patients. In general derm and also in the cosmetic side here. This is my hand down here, my patient's hand. So a lot of people with atopic dermatitis will clear their eczema, but they never clear their hyperlinear palm, which is a marker for atopic derm, allergic rhinitis, and asthma. So if you have a hand like this, that means you have a hand that has a little tendency toward those particular things, and this probably means hot water is not your best friend in the winter. You're wondering why you're getting all dry? Well, you've got sensitive skin, and that hot water is drying you out. Now, how do you define a hot shower that's too hot? Basically, if you fog up the mirrors in your bathroom, it's too hot. So if you have dry skin, you need to go ahead and cool that thing down, not cold, not freezing, but have it be lukewarm. You also want to use gentle cleansers. Now, what's the common over-the-counter one? Well, Dove, Tone, Caress, Oil of Olay. What are the ones you should strictly avoid? Ivory, Irish Spring, Dial, Safeguard. Those are all soaps that are going to bug you. So don't do those. And then you want to use moisturizer. Now, we have specialized moisturizers here that have ceramides in them. Basically, those ceramides can rebuild your skin. Now, what makes a person with atopic derm have sensitive skin? Well, we have figured that out basically on a substance level. Ceramide, which is a lipid, comprises 50% of your intracellular glue. So, your intracellular glue, 50% ceramides, atopics don't have enough of it. They don't have enough glue, therefore their skin is more fragile. And there's been studies done where they've taken skin, where they tested baseline, use a ceramide containing product on it, and the ceramide from the cream gets into the skin and reinforces your own ceramide and makes your skin stronger. So using a ceramide containing moisturizer is going to make your skin stronger at the same time it moisturizes and you're better off. Now what does this mean? That means you use this every single day because you want to keep rebuilding your skin and getting it stronger. So that can have a huge influence on your overall well-being. Keep in mind another key thing. Now people up north know this all the time, but get a humidifier for your bedroom. Your air conditioner's on high, it's drying it out. Your heater's on high, that's absolutely drying it out. And that's why people in Texas tend to get so dry in the winter. We all have central air. That air gets dried out by our heaters, and our skin gets dry in the winter. Up north, they have radiant heat. It comes from the floor. Here we have central, and if you're an atopic, you often don't do very well with that. So this is how I explained it, what I just said. They have a ceramide deficiency. 50% of the glue holds the skin together. Don't have enough glue, more fragile, winter, harsh soaps, rough fabrics. All of them bother than any other people. Daily use of the ceramide cream may reinforce and make it stronger. So sun, we call this actinic damage. So skin lesions, lentigos. There is no such thing as an age spot. No age spots exist. They're all sunspots. So if you're wondering, do I have sunspots on me? Well, you look at your arm and kind of give an assessment of what it looks like. And you look at this part of your arm right here. Now, typically, lots of spots, no spots. Those spots are the same age. The difference between this skin and probably your bottom is sun damage. So everybody has it. People think it's normal, but it's not normal. It's from sun damage, and this whole, like my generation has it because we had no sunscreen at all. But sunspots, the brown spots, are lentigos. Now, idiopathic guttate hypomelanosis, what is that? That's the white spots people get. So sometimes your skin can't freckle enough, it gives up, and you have white spots, which are not dangerous, but they're simply a sign that you've had more sun than your skin can handle. We then have melasma. They call this the mask of pregnancy. Basically, in your pituitary gland, this is most common in females, the part of the female hormone that regulates your female hormones in your pituitary is adjacent to your melanocyte stimulating hormone. So when women cycle through with their menstrual cycle, that melanocyte stimulating hormone activates and you get an exaggerated tan, and that's basically what it is. If you're not in the sun, you could not get melasma, but a little sun gets you a lot. Now we have bleaches that can make melasma better. The critical thing is you have to wear sunscreen every single day. Now, I tell my patients, 1 day without sunscreen wipes out 1 month's worth of bleaching. That's how sensitive they are. So big hats, they got to really watch it. This can be a very, very frustrating thing to treat. We have a lot of things back here we can do to sort of accelerate making that melasma go away. Thinning skin, actinic ecchymosis, the big purple things people get on their arms. Chronic sun thins out your skin. Those purple marks are a sign of thinned out skin. That means you've gotten enough sun, your skin no longer handles the normal behaviors you do, and instead of having your skin stretch, it tears, it bruises, and that's what makes that happen. That's why people only get it on the top here. This part here didn't get as much sun, even though this part here gets more trauma. All the damage is seen where the sun shines. Poikiloderma savant, that's the stuff on the neck that gives you a red neck. I think we got photographs here. So here's actinic lentigos, lots and lots of them. Now what we can do, we can actually get a photofacial and zap these things. Instead of tuning it into the red, we tune it into the brown, and you can get her face to even up. Now, what else can you do for this? Well, there's other things you can do. Topicals can help too. This is where topical retinoids often come in and work incredibly well to maintain what we have. Now, I like to tell people that a topical retinoid may remove some spots, and it will help, but the main thing is it's going to keep you from having as many things come back. It's going to make your epidermis a lot more thick, a lot more strong, and do things, and it may reverse some of that damage you've gotten also. So, people that have had issues with skin cancers, topical retinoids or diet are one of the critical things we like to have them use, because the face is the one place you certainly don't want to have a cancer occur. Now, photofacials will also remove sun damage, like actinic keratosis. So you think, well, insurance would cover it? Nope, insurance does not cover it. They don't care. But we have things that will make you look better, and you will get a benefit of probably having less things go bad in the future. So again, here, a darker skinned person, but she still has an awful lot of freckling going on. Again, these are sunspots that she had, not age spots, and we can actually make a lot of those go away with the photofacial. Pigmenteer, this is from the sun long term. You can again zap it. This is one IPL or one IPL photofacial. I think Brittany did this one here too. So you get that skin to be a lot better, to lighten up, and get your pigmentation to be a lot more even. So here, before a photofacial, and then here we have after, a little overexposed, but we got a lot of that brown to go away. Here's lentigos on the face here, and we ended up blowing them up and getting them to even out and look a lot better. So not only for the face, also for the chest here. So here we have before, after it is lightened up. We can keep lightening it up. But see, you can still kind of see some of these spots, but they're definitely lighter than what they were before. As you keep doing it, the depth goes down a little bit more, you get a better and better results. Melasma, this is the one from hormonal stuff. Now, to be honest with you, if you read books, they always say that melasma is caused by birth control pills. Probably 2/3 of women I see with this aren't pregnant and aren't on birth control pills, so that is not true. This is something that just happens, I think, also on a genetic basis. Here we're doing a trichloroacetic acid peel and some IPL, and you can see we've lightened up this melasma considerably to get it quite a bit better for her. Here's another one here. The lasers can also help with the pigmentation. Now, lasers are kind of nice in that they don't make your pigmentation worse. Photofacial, sometimes we worry because we're treating a light-induced thing with light. FX laser, the fractional lasers, are actually burning things. Now, you worry, well, could that make skin turn different kinds of colors? And it really doesn't seem to do this. What finally convinced me, I went to a meeting where one of the presenters was from China. Well, all of his patients were Chinese, which have darker skin, and they have the most reactive skin of any people on the whole face of the earth. He had no trouble with pigmentation. So anyone, I think, can do a fractional laser and not have trouble with it. And we may not have got every bit of it gone, but she had considerable improvement, and now she can go ahead and have this be improved with makeup and other things like that. These are examples here of the idiopathic gut ache. This is where your skin is given up. And when these happen, we can't really do anything about it. But be sure and wear your sunscreen, because you're not going to be having it get better if you don't. These are the things on your arms. Now you look up here, look how good that skin is up here. That's the same age as this. The difference is this is in the sun, this was protected by the short sleeve and by the rest of the arm. These bruises here are from the sun. That's what's done this to them. These people have to protect themselves from the sun. Here's the classic redneck. They call it chicken skin, poikiloderma, and it usually spares exactly the Adam's apple right here. The chin sort of makes it spare that, but this is it. We can actually use photofacials for this and get this considerably better also, and have people be a lot happier with it too. Now we're going to talk also about the age-related changes, because we're talking about sun a lot and genetics, but you know, our years of age is, there's normal things that happen to us we don't like. Age 25, you look like this. Age 45, they digitally aged it, but you're looking older. What did they do to this? I mean, you can tell it's the same person, but what actually makes them look different? Basically here, you got a little bit more fat. It's more evenly distributed. That's why they say you have a baby face, you know, which looks great. Okay? Facial proportions shift. Okay? That happens too. And the aging face structural changes in both fat and bone is really what does it. Muscles too, to a lesser extent. So, you know, on one hand we have the surface. Now we're talking under the surface to try to get that to look better. So this is normal, loss of subcutaneous fat. So here's a young person with a really great fat layer holding up their skin. We get older, we start to lose this. And you may have noticed people that get on a giant diet, well, they look older. This is what happens to them then. They lose the fat layer in the face, and you have the same amount of skin, so the skin comes this way and goes that way. And that's part of the aging process. So these lines here, people often try to change the lines here and treat it. But the deal is the problem is there's no structure to hold that skin up, and that's what's making it fall those two different ways, is all this out here has gone away, and the skin has nowhere to go. They call it gravity, but it's really a loss of subcutaneous fat. Here's a young person's skull, an older person's skull. First off, the opening to your nose gets a little bigger, so your nose shifts down a little bit. Your eye socket gets bigger. This is what makes that little tear trough that I'm getting myself right now. That's what makes it happen. So is the cream going to really fix it? Well, some of the creams have little reflective things in there that make the light do things to make it look better, but this is really a structural problem. That's why creams help, but they're not the total answer. The deal is you need to get something in there to make that skin be propped up again. Your cheek actually comes in. So this accentuates everything falling down this way. And then your upper and your lower palate get thinner. They call it smoker's line, but it's really a loss of bone in that upper palate that makes that occur. So when you have these kind of changes occur, you realize it's not necessarily the skin that's causing all the problems. It's the structures under the skin, which are ignored by a lot of people. But changing these is, you know, it can be done. Eventually we'll lose jawbone, and that's what makes people start to jowl a little bit right there. Now we want a face that curves out. Now men can have a fairly flat face, but women need an outside curve to really have a youthful look. Okay, now as we get older, well, you know, we lose that fat, we lose the bone, and we get like this. So we get from the heart to the oval shape. Now what I'm talking about here is sculpture. And some of you may have heard it, but we put sculpture like right here. We put it right there, right here, and then anywhere out in here there's an indentation. When you do that, well, you're going to bring that skin back up. And so what you do is you actually convert her back into her, which is kind of a really cool deal. And this is strictly with the structure. Now keep in mind, this is shadowing. You know, people say I have dark circles. A lot of times they don't have a dark circle. You can pull that skin tight, put a light on it, you can't see dark, it's shadowing. What that does is that getting that skin back up and you now don't have that darkness underneath there. Some people do have lax lids and need surgery, but a lot of times you can make people better just with injectables. Now what Sculptra is basically a injectable that you form your own collagen around. So it's polylactic acid, the same thing they use in absorbable stitches. So it's been used in humans, gosh, for 60 or 70 years without problem. So you're not going to form any kind of an adverse reaction to the product itself. You inject it, you then form your own collagen around the particles. So you're making your own tissue back. So it looks normal, feels normal, moves normal. The only thing is it's slow. The thinner you are, well, the slower it is. The more you make muscle, well, the faster you do it. So it varies person to person how quickly you regenerate your tissue, but you inject it. Here's after a second one. Here's month 7. This is month 20 where we want to go. From one set of shots, you're probably going to improve for up to a year. Most of it will be in the first 3 months, but it'll gradually get you back to where you were before. This is my wife here before she had it done. So she wanted Sculptra done. We put it under her eye here. We put it here, here. And then see where she's sort of flat here and indented here? You put it in. We brought this out. Really subtle. This out here, that's really subtle. But the overall effect, it makes you look a lot different. So I did this, I think, actually in 2012. And then about 2018, she says, I want to do it again, but she wouldn't come in. And then finally she came back in and did it last year. And so, you know, this lasts for a long time. The FDA says you need to say that it lasts for 2 years. This is a product here that once you put it in, it's probably going to last longer because you're making your own collagen, which is going to stay with you for a long period of time. I find a lot of people, we do it and we don't repeat the treatment, the overall series, for anywhere from 3 to 5 years later. Now the deal is the aging process is continuing, okay? But once you get them where they need to be, you've slowed that train down a whole lot to get them better. So here we go. She was actually a runner and ran a lot, real thin. If she'd have gained 20 pounds, her face would have looked great, but she didn't want to do that. She wanted her face to look good, so see, we got the curve back to her face. The angularity is cut off, and this is why it looks like a really nice, gentle look, which actually made it very attractive for most people. Now, she hated this right here, and a lot of people would put a filler there, and that helps it some, but Sculptra is put out here to pull it up. We often take the finger and pull, and if you pull and this line here comes out, you know that it's a structural loss that's making it happen. Well, that's what went on with her. We put the Sculptra into her and pulled this bottom part of the line right out of there. You can see she's full out here now and looks really good right in through here. Now she also had a little bit here, here, and out here. So this lady had sort of an asymmetrical face. So she needed some help all over in different areas. Now we do this in series. Now if you read about it on the internet, they'll say you do it once a month for 3 months and no one does that. I put it in, I wait 2 to 3 months and do it again, and then sometimes 2 to 6 months to do it again, depending on what it is. We vary between 1 and 2 vials per session. She would need 2 vials to get this to where she needs to be, but you can see we got the symmetry back to her face. A lot of these lines are gone. The fullness is back, and she's a lot happier than she was before. So here we go. This is actually one of my wife's cousins, and she smokes, and she just quit, I hope for good, but we'll see. But you know, she has a lot of lines here. Well, here she is after 2.5 years. We ended up getting her face to here. And to see how it pulls your face actually up, you can see from the side how we pulled it up and gave her definition back into her face before, where she didn't have it originally. And around the mouth, sometimes this can be a really big boon because this is a very tough area to heal. Sometimes we really need a combination of many things, lasers, Botox, whatever, but sometimes you can have very good results just with that there. So the advantages is, they say natural, well, you're not putting a natural thing in, but you're creating a natural thing, your own collagen to replace what you have lost in muscle and in bone. Replaces your own collagen, greater than 2 years, they did say that. Natural global volume, not just one line, this is for the entire face. Less painful than other injectables and no downtime. Now that's not entirely true. You may have bruising that can last for a month. Not for a month, for a week. But so usually if we have somebody that does this, we say don't plan on anything big for the next week. And basically you don't go back to your baseline is what you don't do because some of your stuff will stay with you. Now Botox, this is for lines that move, okay? And this was the original aesthetic agent that people kind of love. And you can see she's scrunching down her face here, making her crow's feet. If the line is dynamic and moves, that's where Botox will really help you. And if you look here, we can see she's trying to scrunch down now, but she can't really do it. Now, some people have an 11, some people have a 1, some people have 111. Typically, when you inject it, it can take up to 2 weeks to work, and most everyone will get 3 months out of it. Now, when you're injecting your muscles, well, they can't really move. And so it's sort of like when you work out. You work out really hard, you got really strong muscles. Well, then you quit, well, they get weaker. Well, if we inject you with Botox, your muscles get weaker. So sometimes the effect lasts longer because, well, those muscles take longer to regenerate. Here it is around here. So we actually did a photofacial because of the sun damage here. You can see we got it all to lighten up, and that's pretty well gone. Talk a little bit about fillers. These are actually things, now, Sculptra is a volumizer. These are fillers. They can fill in wrinkles or add volume, either one. So these are more specific for certain lines and certain uses. If you want one area kind of fixed. I like Sculptra for the global. If you have one area you want to work on, these can work. So different fillers work better in different areas, and we kind of can guide you in picking out which one would be the best one for you. So it's very easy, quick. Sculptra is like watching grass grow, really slow. You say, I want to look good in a month and a half. Well, Sculptra is probably not going to be your answer. One of these HA fillers may be the one you want to do. So for isolated facial wrinkles or sometimes volume in the cheeks, we can pick out one that can fill and lift and produce dramatic results. Disadvantages are eventually reabsorbed. So most of these are going to last sometimes a year, sometimes a little bit longer than that, but you have to retreat at intervals. They're a little thicker, so sometimes they can hurt a little more. Now, if you want to do lips, and I always caution people about lips, because when you're doing lips, you don't want to look just straight on at them. Straight on looks one way, from the side looks different. You want to look good from the front and the side, and that's what a lot of people don't realize. So we try to get the lips to be a little bit fuller. When they first were doing lip fillers, they trained us to put it right around the edge. Well, that's the one that makes you look kind of like a duck. So you have to be really careful about that and not do that so much. And some of them need it. I mean, you need to do it, but you can overdo it. But it's really true. When that first happened, it was like, what happened to that person? But then now, we never make you quack ever here. You're going to not do that. So Juvederm will get you to look really good here. See, lips are okay. Lips are just a little bit fuller. You want your lips to match your face. My wife has 8 adult female cousins, and a couple of them come down, and every time they're down, they want more in their lips. And I say, no, you don't need any more in your lips. Your lips look fine, but they always think they need more. But if I think you've had enough, I will say you've probably had enough. Bigger is not always better in lips, okay? So from the side, see her lips look great from the side, even not too big, not looking too protruding. It's good. So here we go. This is one here, Kybella. So a lot of people have a little, extra underneath the chin. Basically what happened, this is one that Brittany did here. So you can see here, Brittany got it here. She got this to go away here. My own daughter-in-law did this before. She wanted to do it before the wedding. I wouldn't let her do it. I said, you got to do it after because something's going to happen if I do it before. But, this is something that can really make a person happy with an injectable to make things look good. Now we're going to move into hair. So lots of hair here. People don't like hair in certain areas. We can actually go ahead and zap it. Now keep in mind, this is going to work best on dark hair. The laser light picks up the pigment in the hair. There's no pigment in white hair, blonde hair, so it doesn't really work. So if you have blonde hair, it's not going to work. Your best person for this is somebody with really dark hair and really light skin, and they're going to get the best results from it. For underarms, it can work really, really well. You can actually get to where you don't have to shave at all. Ears. Guys will often get in their ears. I know I'm getting some of that now too. It's very frustrating. But you can zap it and then you don't have to worry about it. It's a good deal. Backs, you can do the entire back if you want and get it to go away. So now I think that's kind of where we're at with that. I'm going to let I think Izzy take over and talk about what all we have here. Keep in mind, this is like, weeding the garden. It's not like you do one thing and you're done. You do things and then you do more things. But I also like to say it's not like cosmetic procedures are a lot like a cheesecake. One piece is good. You don't eat the whole cake at once. Those makeover shows they have where they do everything and then they bring them out and people think, who is that? I don't know that person. That's not really what we want here. We want you to look like you so people know who you are. And then, you can make incremental changes to keep you looking good and be, in a good place with all your friends and family members and stuff like that. So any questions about all this so far?